Welcome back into Talking Fitchburg. Joining me today is our emergency management staff, Jeff Dostalek and Joe Pulvermacher. Well, when I say emergency management, it's really Joe Pulvermacher. He's your emergency management person. Jeff Dostalek is your deputy chief of Fitchburg EMS. Jeff, we start with you. The Fitchburg EMS getting prepared, obviously. You guys have seen quite a bit of an uptick in calls in the last couple of months. Yes. Just in general, it's a busy time of the year anyways. But as we move into this new world and the coronavirus stuff that's happening, what are some of the things that Fitchburg is doing to get prepared at this time?
Sure. So much like all of the other departments in the area, we're just looking to see what the CDC, the World Health Organization, is putting out. We're taking a lot of directive from Dane County Emergency Management and Dane County EMS, and we're just educating our staff as to what the signs and symptoms of the coronavirus are, what kind of PPE that they should be taking. I think the thing here is to recognize, that this is a virus that is in our community, is going to be coming into our community. We don't have to panic, but that we do have to be prepared. And I think Joe will talk a little bit about that as well. We have, directed our staff to make sure that they take the precautions when they go into a home where there is a potential that the coronavirus is there. So we'll look for signs and symptoms of fever with a cough. If they have somebody's shortness of breath, the flu-like symptoms. They'll be wearing their N95 masks and goggles and gloves just to be prepared, and then just letting them know, what the expectations will be as far as transport to the hospital and such.
When you talk about PPE, what are you referring to? And fire and EMS deal with this every time. It's part of the first part of the chain.
Right. So personal protective equipment for us is going to be an N95 mask or a surgical mask that they'll wear, goggles and gloves, and that'll cover about 95% of the stuff that we're going to see out in the field, including the coronavirus. So you will see our paramedics and our first responders coming into the scene wearing that stuff. It doesn't mean that we have it or that you have it. It's just protecting ourselves and protecting the patients as well, so that they don't catch anything.
For the fire department, PPE goes a little bit further.
Well, it's similar actually. We train with the same type of masks. The N95 masks are the more efficient option at this point. We still have a supply available. We're trying not to overuse that as far as our protection is concerned. But at the end of the day, we do have additional means of providing a respiratory protection. But then it gets into things like our SCBA, and it's not that we would never use it, but it does send a completely different message as far as the level of concern. And one of the things that we're trying to be very cautious of is not to overexcite the situation. You can understand the concerns associated with exposure without necessarily contributing to something that is making this worse than what it actually is. And that's what we're doing right now, is we're just trying to learn more about what's out there, how the exposure happens, what the signs and symptoms look like, and what we can do to best protect ourselves from that exposure. It also comes in play with personal contact and how close you are. So at the fire department, what we're trying to do is just get our providers to appreciate the fact that this is like any other contagious vector that's out there that would potentially cause ill effects. And this one we just know about in advance. There's others that we don't know about in advance. So I think to that extent, that's the scarier situation. Here we have an idea of what we're being exposed to and what we can do for it.
Yeah, behind the scenes, a lot of things are happening. There's a lot of moving parts to this. I think the big one, staying in this realm of being afraid, if you get the coronavirus or you start showing these signs and symptoms, what should really be the response of a person who gets that? Are we dialing up 911 right away, or Jeff, what are we looking at here?
Yeah, I think if you have those flu-like symptoms, so they're saying a cough with a fever, shortness of breath, the things that you would recognize as being the flu, and you feel that you need to be treated, I don't necessarily think calling 911 is the answer. What they're saying is to go ahead and contact your primary care physician, whatever insurance company that you have. They're on call. Ask a nurse. Go through that realm first, and they will tell you if it's something that you need to come in and be seen. I know that there are people out there that don't have insurance, don't have a primary care physician. Concentra and Access Community Health Centers, and we'll put that information out there as well. You can contact those free services and ask the same questions before you get transported into the emergency room. Obviously, if you have things like severe shortness of breath, you have chest pain, those things that may just be ancillary to having a fever and a cough, you want to call 911, and then we'll come and do an evaluation and transport you to the hospital.
Looking at the emergency management side of this, Joe, we got you both, and I appreciate you taking the time way earlier as this started to develop in the U.S. We talked to you guys about, pulling together the plan. Well, technically, the plan's been rolling here for quite a while now. What phase are we in here as far as mobilization of our emergency management here, City of Fitchburg?
Well, we aren't necessarily in any specific phase at this point. An awareness phase, I guess you could call it, knowing full well that we have the disease in the country. There are some in the area that have been exposed to it, and there have been some positive tests. But I guess one of the things that we're also trying to do is educate. So that would be probably another phase of what we're trying to put out there. Just because something is more contagious doesn't make it more fatal. You might have more people that are ill as a result of this virus, but it doesn't necessarily make it more fatal. And that really speaks to the social pressure that's out there right now as far as some of the things that are being canceled and suspended. Because of the fact that there is a social pressure. Nobody wants to be responsible for spreading this disease. This disease will spread regardless of whether it's done in a group setting or not. And what we are trying to get people in the habit of doing is not getting to the point where they are so concerned about catching this disease that they limit all activity and then therefore create other issues. I mean, the whole social ramifications associated with not going to businesses is going to create sort of this backlash. And I'm not suggesting that capitalism needs to drive patient care, but I also want people to be fully aware of the fact that if they do the same measures that they've typically done for everything else, the risk of exposure is not as extreme as it's being played. The fact that it's on every channel does not help. There is a sense of urgency. I like the fact that we're aware of the fact that we have a problem that needs to be identified. We need to know what our response is so that we can do that in a way that doesn't spread. But the general nature right now of this being something that has taken on somewhat of a life of its own is concerning. And so we're doing our best to stay on top of it. We'll make sure that we provide appropriate information. We're going to do it as a collective. So the things that you see from Fitchburg are typically going to be the things that you see from Dane County and from Fitch-Rona EMS. There is no reason for us to provide anything different and create confusion. So that's one thing that I can say that is happening right now, is the fact that we're working together on a common, consistent message.
I think the things that people can do, just to kind of dovetail on what Joe said, is take those necessary precautions at home. Wash your hands. I know that that's been something that's been put out into the media. There's YouTube videos on washing your hands. That you can protect yourself by washing your hands. The hand sanitizer is a good alternative to that. It is not something that would take the place of washing hands. So if you can't wash your hands for some reason and you have hand sanitizer, do the same things. 20 seconds. Rub it around your hands, between your fingers, over the tops of your hands, your fingernails, all that kind of stuff. But when you have the first opportunity to use a good soap and water, wash your hands. don't touch things that you probably shouldn't touch. Have those sandy wipes with you to wipe stuff off. I think those types of things we should be doing all the time anyway, and that helps prevent the spread of coronavirus. It helps prevent the spread of the flu, which happens every year. Just taking those necessary precautions would be beneficial to everyone.
Final question here is the preparation. We're seeing again the way it's being, and I know I'm part of the media, factory. We're a department here at City of Fitchburg, and yet we're trying to play on that balance too of making sure people are prepared, understanding. But I've talked about washing hands for weeks upon weeks upon weeks, and I think that's part of the education piece. But as far as our preparation goes, I don't want to send people to rush to the grocery stores, rush in and buy all this stuff and whatnot. But when we're looking at preparation and getting prepared for this, from your guys' standpoint, where should we fall?
So I can say this from an emergency management perspective. I think independent of the coronavirus, I think every home should have a ready kit. You should have water available. I'm not suggesting that you go out and buy 5 cases. There's recommendations that we can suggest as far as water, food, medications, those types of things. But that's for everything. That's even when you have severe weather, for example. Those types of things can be discussed in advance. Have a means of contacting friends and family. Know how you can get in contact with them so that you have a better indication that where people are and how people are doing. Check in with your relatives, especially the very old. Those that have a medical history, just get them on the phone and call them and talk to them. Those are beneficial. I know people right now that are buying toilet paper because they're afraid they're going to run out at home.
I think we determined that was the 3 of us here.
So it's one of those things where I guess great for the paper industry, but I don't know what benefit it's providing us other than creating a shortage that we typically wouldn't see. So being very cautious as far as the information that we're putting out there, trying to make sure that whatever we do is obviously adjusted based on fact. And we will make sure that whatever information we're putting out is completely vetted and hopefully doesn't buy into some of the hype and hysteria that has a tendency of happening when people are doing things, when there's unknown factors. And people may get sick in this situation. A lot of people will get sick. I'm not going to deny that. But we see that every year with influenza. We talked about this last time we talked. RSV, for example, is something that we see in children every year, to some of the same numbers that we're seeing right now. And nothing really has built up the hype that this has.
Yeah, I hope people out of this will, and I've heard it said on the media a few places, so I'm not the creator of this, but that this could be an eye-opening thing, that it doesn't matter what it is that comes through, the basic element of being prepared for something like this in the future, whatever name comes to it, whatever it is, it's possible in the future, and while it's we're in this right now, looking into the future, it should be a better status. This should be your chance to check that plan, and then in the future, how can you build on that? And that's what you guys will do after this. We'll go back and assess this, and we'll have new stuff that comes out from this.
Part of what we do, too, is the recovery aspect, right? So there is going to be a commercial recovery that needs to come out of this. So I think one thing that companies, not just Fitchburg companies in general, should be doing is looking at their continuity of operation. How can they keep themselves in business as best possible? Keep their employees working as much as they can, whether that be remotely or not. Understanding that sometimes even with a self-imposed isolation or even a quarantine, work can still get done. It's just a matter of how remotely you can do that. So I know that's case by case, company by company, But there are some that can maybe take advantage of having that discussion now, because the social implication right now of not being a quarantined individual or not self-imposing isolation has some other detrimental effects that don't necessarily have to be. And look at the continuity of operations, see what we can do. I know we're addressing it here at City Hall.
Yeah, absolutely.
Yeah, and I would echo that. If you're sick, as hard as it is, because we all need to have jobs in order to pay bills, you need to stay home and not even just getting from point A to point B. Stay home, call the health, your primary care physician, find out what kinds of suggestions they may have. And Joe touched on a little bit the social aspect of this, especially with the elderly. We talk about Meals on Wheels and visiting people. Reach out to your neighbors that might be elderly. Sometimes they just need to have somebody call and talk to them, and if they can't get out of the house because of this, or they're afraid to get out of the house because of it, just reach out to them by phone and just check in and make sure that they have a little bit of social contact. It goes a great distance in helping everyone's psyche to get better and to get through this, and they're not isolated.
And you don't have to go out into the public, even for medications. I know we have pharmacies in the city of Fitchburg that will deliver to you. I know that we have other stores in the city of Fitchburg that will deliver even groceries to you. So reach out and take advantage of those things. You don't necessarily have to create additional exposure. It's not all that necessary, and reach out to family and friends and see how they can help you. So we're trying to help people help themselves initially, and then after that is not successful, how can we implement a certain degree of assistance from the government side?
Guys, thank you so very much for talking with us. Appreciate you getting back on here. Certainly, as things evolve in this, it's a day-to-day thing. It can be hour to hour. It just depends how it's moving. We'll keep you updated here on Fact TV. Well, we'll get these two back on here. I mean, come on.
Yeah, well, next time, can we have some makeup? Because
more coffee too.
Yeah, and more coffee and makeup.
Yes, sir. All right.
Take care, everyone.
Yeah. That again for emergency management, Joe Pulvermacher and Jeff Dostalek, Fitchburg EMS. We'll get them back on here if anything changes, and just take it safe, take it slow, and check on those resources. We'll take a quick break. You're watching Talking Fitchburg.